So it could be a very severe condition. William came in from Ohio, and they wanted to come here because we provide a minimally invasive technique for this procedure, where we literally just open up this suture just the way it was intended to be, and it allows the child's brain to actually push and remodel the bone and to grow normally, so that the child no longer has pressure on their brain. They will not have these developmental delays that are common in the other kids. And then additionally, and they'll just grow up to have a normal life.
And that's really important also, because this is something that can be done, fairly, I would say, not painlessly, but just more so quickly than any other type of surgery for this particular case, correct?
For sure. The other type of surgery is extensive, and we have to take off the entire skull and the orbits of these kids and expand them. And the most kind of upsetting thing to me about that surgery, the one, they almost all need blood transfusions because of the amount of blood they lose. They need to stay in the hospital for 4 to 5 days in the ICU, and they're more prone to complications. And then additionally, as the years go by, a lot of times the results, they have some relapse. So when we catch them young, like William, and we're able to do this minimally invasive surgery, it makes a huge difference for them and their outcomes. And it's really, an honor to be able to do this for kids.
And tell me about what he looks like after surgery for those that may not, because we talked about the other option, but this is a tiny incision, so you mentioned that, but just give us a brief overview if they weren't able to visually see.
So basically what we do is we take the child, and they're laying on the table, and instead of the big technique where you make an incision from one ear to the other and you flip all the skin down over the face and take off all this bone, all we do is we make a very small incision, about 1 inch, right here above that suture. And then we take instruments and we basically just take away a thin strip of bone right here, and that recreates the suture that child was supposed to be born with. And then they stay 1 night in the hospital, they go home the next morning. In William's case, he lost 1 tablespoon of blood. And he did great. He did great. So he right now still has a head shape that is a little bit more triangular. However, this will rapidly start growing out and correcting. And, by the age of 5, you'll never know that this kid ever had any surgery at all.
Great. And then her next question is going to be, did you meet the Brumleys? And if so, your impression or reaction? We know that you've met them, but what's your impression and reaction?
Yeah, so the Brumleys, they're a super special family. They contacted us because they found out through the internet that we do these minimally invasive approaches for the surgery, and the hospitals up there would not do them at the age that he was. So immediately upon contacting, we do a virtual interview, and I got to meet William and John and Emily, and they're super pleasant. They're very friendly. They're super kind. William is super cute, so he really steals your heart right away, and he's just got these big eyes and a great personality. So, me and the baby, we connected, and the parents too, and so, yeah, really, really friendly family, and they were just looking for a place where they could get kind of the best treatment for their child. And so we're honored that they chose El Paso Children's Hospital, and I'm really happy that we're able to have the team here with myself and Dr. Makushi and our entire craniofacial team and OR staff, which are able to do these very complex surgeries on these very small infants. So.
And Dr. Yates, what does it mean to be able to bring a family relief, especially during this holiday season? It's kind of a gift, for the family to be able to go back home right before the holidays, feeling relieved. How does that feel as a doctor, to have that feeling that you're giving that gift this Christmas season to the Brumley family?
Yeah. I tell everybody I have the best job in the world. You know, I feel like we get to go in and help kids, and then they do well. They do well, and to see them grow and thrive, to know that William is gonna leave here, fly back home, and live a perfectly normal life. Whereas just a week ago, had he not had this surgery, that wasn't necessarily going to be the case. You know, I feel like it does more for me than probably even them, but it really is just the best feeling in the world. So we had, you know, obviously there's multiple patients that we're working on during the Christmas break, and kids want surgery during Christmas because they have a break. And one of the other families we did, you know, they reached out last night and they sent me a picture, and after the correction of the deformity, they're like, he looks just like his brother. And, you know, it makes it worth it, you know, all that time. And these cases can be difficult, you know, and for the kids to do great, I mean, that's everything, you know.
Very special. And talk about, she's asking talk about the surgery, but you already did.
Yeah.
So we're good with that one.
Yeah.
Talk about William's situation, you already did that. And have you done this type of surgery before? You have.
Yeah.
But how many, if you could give us a count, even if it's just a round number, how many of these types of surgeries have you done before?
Yeah, so, you know, I'm very thankful. We really are a worldwide center for endoscopic craniosynostosis surgery. And this is in many thanks to my mentor, Dr. David Jimenez. And he invented this endoscopic technique 28 years ago. And so we really at that time became a center worldwide for this kind of surgery. And we have patients coming from all over the globe, all over the nation for this surgery. So, you know, we do hundreds of these, and these are not common. You know, the average number that is born with this is 1 in 2,000 live births. So, you know, many centers, you know, to do over a dozen, they're doing pretty good. But I feel very fortunate because here we see kids from all over the country, all over the world, and this is something we do all the time. So.
Great answer.
Awesome. Anything else that you feel like you want to mention about this particular case?
Let's see. Is there anything else you feel like we should
I feel
mention?
like you covered a lot.
Yeah.
I'm trying to hear them.